Hello, viewers. Welcome back to another educational video. Today, we're diving into a critical topic that affects millions of people worldwide: heart disease. Did you know that heart disease is the leading cause of death for both men and women in the United States? What's even more alarming is that every 36 seconds, someone loses their life to this condition. Heart issues often develop silently and don't always come with obvious warning signs like chest pain or breathlessness. Recognizing the early symptoms can be a lifesaver. In this video, we'll uncover 10 early warning signs of heart disease that you might not be aware of. From unexpected fatigue and persistent cough to anxiety and swollen ankles. Stay tuned to learn how you can identify these signs early and take proactive steps for a healthier heart. Don't forget to subscribe to our channel for more insightful health content. Let's get started. Number 1. Upset stomach. An upset stomach can often be overlooked as a symptom of heart issues. When the heart is struggling, it can send signals that manifest in gastrointestinal distress. This means symptoms like stomach ache, vomiting, and acidity may not always be mere digestive problems but could indicate underlying heart disease. Number 2. Persistent cough. A persistent cough is often associated with common illnesses like colds or the flu. But it can also be a sign of heart problems. When the heart is not functioning properly, it can lead to fluid buildup in the lungs, which in turn can cause a continuous cough. The link between a persistent cough and congestive heart failure lies in the heart's inability to pump blood efficiently. When the heart's pumping power is reduced, blood can back up into the veins that return blood from the lungs to the heart. This increased pressure in the blood vessels can cause fluid to leak into the lungs, resulting in congestion and a chronic cough. If you experience such symptoms, it's important to consult a healthcare professional promptly. Number 3. Random cold sweats. Sweating is a natural and healthy process that helps regulate body temperature. However, there's a difference between normal sweating and cold sweats. Normal sweating occurs due to heat, physical activity, or stress, while cold sweats can happen suddenly and without any obvious cause. Cold sweats can be related to heart issues, specifically heart inflammation or other heart-related problems. When the heart is under stress, it can trigger the body's fight or flight response, leading to cold sweats. This symptom could indicate that the heart is struggling, possibly due to inflammation or other cardiovascular issues. If you experience random cold sweats, especially in conjunction with other symptoms like chest pain or shortness of breath, it's important to seek medical attention immediately. There is a significant relationship between anxiety and heart health. Chronic anxiety can have a profound impact on the cardiovascular system, leading to increased heart rate and blood pressure, which over time can strain the heart. People who experience long-term anxiety are at a higher risk of developing heart disease. Chronic anxiety can lead to behaviors and physiological responses that increase the strain on the heart, such as elevated cortisol levels, increased blood pressure, and unhealthy lifestyle choices like poor diet and lack of exercise. Studies have shown that individuals with significant anxiety from an early age are more prone to heart complications later in life. If you experience severe or persistent anxiety, it's important to seek help not only for your mental health but also for your heart health. Number 5. Leg pain. Leg pain, particularly during physical activity, can sometimes indicate a condition known as peripheral artery disease, PAD. PAD occurs when there is a narrowing or blockage of the arteries that supply blood to the legs, arms, kidneys, and other parts of the body outside the heart and brain. Common risk factors for peripheral artery disease include smoking. Tobacco use significantly increases the risk of developing PAD. Diabetes. People with diabetes are at higher risk due to damage to blood vessels. High blood pressure. Hypertension can contribute to narrowing of the arteries. High cholesterol. Elevated levels of cholesterol can lead to plaque buildup in the arteries. PAD restricts blood flow to the extremities, causing pain and potentially leading to tissue damage or even amputation if not treated. If you experience persistent leg pain or discomfort, especially during physical activity, it's important to consult a healthcare provider. Early detection and management of PAD can help prevent complications and improve quality of life. Number 6. Swollen ankles. Swollen ankles can sometimes indicate underlying heart-related issues. When the heart is unable to pump blood effectively, fluid can accumulate in the lower extremities, leading to swelling in the ankles, feet, and legs. If you experience persistent swelling in your ankles or feet, it's essential to consult a doctor promptly. While swollen ankles can have various causes, including lifestyle factors and other medical conditions, it can also be a sign of heart failure or other cardiovascular problems. Number 7. Unexplained fatigue. Unexplained fatigue can often be a sign of inadequate blood supply to the tissues, which is a hallmark of cardiovascular disease. When the heart is unable to pump blood effectively, the body may not receive enough oxygen-rich blood to meet its needs, leading to feelings of exhaustion and fatigue. Unexplained fatigue is particularly noteworthy as a precursor to or during a heart attack, especially in women. Women are more likely than men to experience atypical symptoms of a heart attack, such as extreme fatigue, nausea, or shortness of breath, rather than the classic chest pain. This fatigue may occur days or weeks before a heart attack, and can be a signal that the heart is struggling to function properly. Number 8. Dizziness or lightheadedness. Experiencing frequent dizziness or lightheadedness can be unsettling and disruptive to daily life. These symptoms might make you feel as though the room is spinning or that you're about to faint. While there are several potential causes, it's important to understand that this could be a sign of an underlying heart issue. Dizziness or lightheadedness can result from common and less severe conditions such as dehydration, side effects from certain medications, or anemia. Dehydration can decrease blood volume, leading to a drop in blood pressure and causing you to feel lightheaded. Similarly, some medications can affect your blood pressure or heart rate, making you feel dizzy. Anemia, characterized by a low red blood cell count, can reduce the amount of oxygen carried to the brain, contributing to these sensations. However, when it comes to heart-related causes, the stakes are higher. Dizziness or lightheadedness can be a symptom of more serious cardiovascular issues, such as artery blockages or faulty heart valves. When arteries are blocked, blood flow to the brain can be restricted, leading to dizziness. Faulty valves, which fail to maintain proper blood flow and pressure, can also cause these symptoms by preventing adequate circulation to the brain. Number 9. Depression. Mental and physical health are deeply interconnected, and depression is a prime example of how this link can affect overall well-being. Depression doesn't just impact your mood and mental state. It can also have significant repercussions on your physical health, including your heart. People with depression are at a higher risk of developing heart disease. This connection is due to several factors, including increased stress levels, poor lifestyle choices, and physiological changes in the body. Depression can lead to elevated levels of stress hormones like cortisol, which can raise blood pressure and cause inflammation in the body. These conditions create an environment that is more conducive to the development of heart disease. Number 10. High cholesterol. High cholesterol is a major risk factor for heart disease. Cholesterol is a fatty substance found in your blood, while your body needs some cholesterol to build healthy cells. Too much of it can lead to the development of fatty deposits in your blood vessels. Over time, these deposits grow and make it harder for enough blood to flow through your arteries. This can eventually lead to heart attacks, strokes, and other cardiovascular problems. High cholesterol often presents no immediate symptoms, making it a silent threat. Most people are unaware they have high cholesterol until they undergo a blood test or experience a significant health event like a heart attack or stroke. Managing high cholesterol is crucial for maintaining heart health. Here are some effective ways to control cholesterol levels. Healthy diet. Focus on a diet low in saturated fats and trans fats. Incorporate plenty of fruits, vegetables, whole grains, and lean proteins. Foods rich in omega-3 fatty acids, such as salmon, flax seeds, and walnuts, can also help improve cholesterol levels. Exercise. Regular physical activity can help raise high-density lipoprotein, HDL, cholesterol, the good cholesterol, while lowering low-density lipoprotein, LDL, cholesterol, the bad cholesterol. Medications. If lifestyle changes alone aren't enough to manage your cholesterol, your doctor may prescribe medications. Statins are the most common cholesterol-lowering drugs. But there are other options available depending on your specific health needs. Regular checkups. Regular monitoring of your cholesterol levels through blood tests is essential. This helps in keeping track of your progress and making any necessary adjustments to your treatment plan. By taking these steps, you can effectively manage your cholesterol and reduce the risk of heart disease. Remember, maintaining heart health is a continuous effort that involves both lifestyle changes and, if necessary, medical intervention. Number 11. Left shoulder pain. Left shoulder pain can sometimes be a sign of heart trouble due to a phenomenon known as referred pain. This occurs when pain from one part of the body is felt in another. The nerves in the heart and left arm send signals to the same brain centers, which can cause the brain to interpret heart pain as pain in the shoulder or arm. If you experience pain or pressure in your left shoulder, especially if it's accompanied by other signs of heart distress, seek immediate medical attention. This pain can be a warning sign of a heart attack or other serious cardiovascular issues. Prompt medical intervention can be life-saving and help prevent further complications. Don't ignore these symptoms or attribute them to less serious causes without investigation. Your heart health is critical, and early detection of heart problems can lead to more effective treatment and better outcomes. Number 12. Sleep apnea. Sleep apnea is a sleep disorder characterized by the intermittent stopping and restarting of breathing during sleep. This condition can significantly impact heart health. When breathing pauses, the oxygen levels in the blood drop, which can strain the cardiovascular system and lead to high blood pressure, arrhythmias, and other heart-related issues. Given the connection between sleep apnea and heart disease, it is important to monitor heart health regularly. If you suspect you have sleep apnea, seeking medical advice and undergoing a sleep study can provide a diagnosis and lead to effective treatment. Treatments such as lifestyle changes, continuous positive airway pressure, CPAP, therapy, or other medical interventions can help manage sleep apnea and reduce its impact on heart health. Maintaining regular heart health checkups is crucial, especially if you have risk factors for sleep apnea. Addressing sleep apnea not only improves sleep quality but also supports overall cardiovascular health. Today, we discussed several early warning signs of heart disease that you might not be aware of. Maintaining a heart-healthy lifestyle is crucial. This includes eating a balanced diet, exercising regularly, managing stress, and avoiding smoking. If you experience any of the symptoms we've discussed, don't hesitate to seek medical advice. Early detection and intervention can make a significant difference in preventing serious heart conditions. Thank you for watching. If you found this video helpful, please give it a thumbs up and share it with others. We'd love to hear your experiences or any questions you may have, so leave a comment below. Don't forget to subscribe to our channel for more informative content on heart health and other wellness topics. Click the subscribe button and hit the notification bell to stay updated with our latest videos.